So why did you decide to get involved in research?
I was recently diagnosed with HIV, and Tom at the Ian Chasson Day Center told me to there was told me about the research and asked me if I would like to be involved, and I thought, well, yes, why not help while I'm getting help with my situation? So.
People are often quite nervous about taking part in research. Are you nervous?
No. In part, was more about getting getting some action a bit faster. So I thought, well, this could be a quicker way into it. And then, as I learned more about it, I was quite happy to actually be participating in it and helping the research.
Yeah, excellent. How did the experience compare to any sort of experience that you're expecting?
Well, I didn't really know what to expect, so it was all very new to me, and it was the first time I took part in research and in a study. So it all was very new, but at the same time, there wasn't anything like that was uncomfortable with, or because there was always a lot of information and everything was very clear at any moment, and they were very helpful about everything. So
yeah, you felt well supported and guided.
Yes,
well looked after.
Completely, well looked after. Yes.
What do you think are some misconceptions about taking part in research?
Well, I think a lot of people are afraid because they're gonna be using me like a little lab rat, trying to experiment on me or anything. So there's a lot of that fear, but there was a lot of information previous to start everything, and like at least a month or two before everything started, there was constant information and a lot of things for me to take home, read calmly, and really decide if wanted to take part on it or not. So all those misconceptions were not there for me. So.
And you were given time to ask any questions you wanted?
At any time, and also very well informed on if I wanted to stop at any point, I will be able to, because it was always my decision and not what they wanted me to do. It was what I wanted to do.
Yeah, and I think that's important to note. Like, even if you say yes to begin with, if at any part you're not able or don't want to continue, that's fine. There's no change to your care or anything.
No, not
it's
at all.
purely your decision. It's a really good point. Some studies you take part in might have a direct benefit to you, so it might result in like you say, a chance to try a new treatment or a change in care. However, lots of studies will be background research leading up to that point. Or it might require people without a condition to take part, to be in a group that doesn't receive any treatment. And it can be really difficult to recruit people to these type of studies. What would you say to people who might be thinking that actually they might like to take part in those studies?
If it's what you want to help other people, then just do it, because it's a way to help us individuals as part of the community to those who actually need it. For example, there's been researches where for monkeypox vaccine, where I never had monkeypox, but I was happy to participate in order to help others that actually might have had it and could benefit from it.
Yeah, so there was no direct benefit to yourself.
So there's no direct benefit from me, but just the thought of helping other people who actually need it is gratifying. Is that what?
No, I think that is right. And you never know, like you say, it might be part of your community or friends or your family in the long run.
Yeah, exactly.
Were there any other benefits, either directly or indirectly, from taking part in research, other than any treatment you might have guessed? Was there anything that just, other benefits that you found?
I think the biggest benefit is the knowledge that you get out of that with, because you get to learn about different things, and in many situations, I think misinformation is what leads to really, really bad consequences when you are in the middle of a bad situation, especially with like a medical situation. So these researchers help you understand, even if you're not part of a certain situation, or you can just learn from it and even learn how to avoid certain things, or or avoid putting yourself in risk of things. So it's really helpful, and it's really, the information you get is crucial to absolutely everything.
And that's a really good point, actually, and one that I don't think we always think of, is that you're learning, and that's always nice, isn't it? So that's a really good point. Finally, is there anything else you'd like to say to anybody perhaps still a bit unsure about taking part in research?
Do it if you really feel like doing it, and if you really want to help, because it really don't take that much time, or it's not really much of an effort, and you just help, and you're not being part of an experiment or anything weird. It's just helping others, help the bigger crowd that really needs it. So
that's a really nice way to put it. And I think, sort of thinking about the time it takes, some studies are quite intensive. Actually, some might just be filling in a questionnaire on side effects
absolutely,
taken, or background information, and it might just take 10 minutes and you're done. It's nice to know that you've been, as everybody should be, treated really well in your research. So thank you.
Not all research is living in a lab. It's like sometimes you can just answer a few questions on an email, and that could be it. So it's like there's many ways to do it, and you just need to ask and for the right information.
How important that stuff, that type of research, is just as important as it is to trialing new treatments and things.
Yeah,
so that's
exactly.
Really,